So friends, what do you think a high-tech OT looks like? So this is the view of a high-tech OT. So everything is patient-centric. So this is the table, OT table, the place where the patient lies down. All right. So here the patient lies down. This is for resting of the woman's legs. Mainly this is a Gynec surgery table. So the neck surgery which is planned is a Gynec surgery. So these are the screens. Okay, this is for the surgeon, this is for the assistant. So all these devices, this is called a laparoscopic trolley. Basically you must have heard about keyhole surgery, and in that keyhole surgery these are the various instruments that are used. This is called a gas insufflator. There are two in number. In case one fails, the second one, or in some cases we require two insufflators at once. This is called the light source. This is called a camera unit, and these things are called energy sources. So energy sources are basically those devices which the surgeon will use to perform the surgery. So yes, this camera is and everything is connected to these two. And in case the doctor requires something called a C-arm, this is a C-arm unit. And behind this thing you will see over there, there is this device which is called a C-arm. It is basically used for an ortho, that is bone surgery, or uro surgeries, which is about kidney stones and all that. So there are things called anesthesia and anesthesiologist. So this is the setup for the anesthesiologist. So various medicines are kept over here in color coded trays that you can see. These are in case of blood loss, these are kept standby over here. Different types of painkillers, antibiotics, etc., etc., everything is kept. Life-saving medicines are usually kept on the first two trolleys, first two rows, and these are the other things. Different types of bottles that the doctor may require are kept below, right there. Okay, so these are various things. Our anesthesia trolley, which the anesthesiologist has requested for. So this is called a basic Boyle's apparatus, and this is called multi-para monitor. This is called a sevoflurane vaporizer. Basically these are things to put the patient to sleep and to make sure the patient has a painless surgery. So today's surgery, the doctor has requested for this. We also have something called a ventilator unit. A ventilator unit is a different unit which today's doctor has not requested for. This is what our today's anesthesiologist wants. Also the doctor has prepared a variety of things for the patient to give the general anesthesia, different things that the doctor may require. These are ventilatory supporting things. Everything is connected to oxygen that is piped through this. It enters the machine, and from there it can go to the patient through the various circuits. So also now these are different surgical drums which are there. One drum has been kept open. So basically all the instruments and the dresses that the doctors would be wearing are placed inside. These things are utilized by the and all these things have instruments inside. They are not kept open because they have to be kept clean and sterile. So this is exactly what the OT looks like. There are other devices. This is called a suction in case something needs to be sucked. And today's patient requires something called an irrigator. So this is called an irrigation, that's a powered irrigation device. Over here the saline goes in over here, enters over here, goes at high speed, and is connected to the patient's instruments, so that the doctor can irrigate certain things very well. So again, this is a computer controlled equipment that is used. Today's trolleys are kept ready as per the case and the surgeon's request, what all instruments are there. Few of these instruments are kept open for inspection right before the surgery. So you can see that these various instruments are kept ready. Some instruments are kept covered for the time being. Once the doctor comes, the doctor will assess everything and go ahead. Now, how does the surgeon stand in this particular case? The surgeon will be standing exactly over here. So today's case is a Gynec case. I'll be standing there, and these are various foot switches that you see controlling different types of these devices. Okay, so there are some foot switches for this, some foot switches for this, and there is another instrument which is kept over here. This is also another device. So there are some switches over here, different switches do different jobs. Again, one small switch there. This is for a device called harmonic, and this is for monopolar cautery. So different things are kept over here. This is a small stage on which I will be standing. This helps me in increasing my height with respect to the table, which makes today's surgery easy and comfortable for the doctor, so that I can keep on operating endlessly. Then today we are removing tumors from the patient, and these tumors will be brought out through a small tiny incision, and we'll be using something called power morcellation. So this is the device which is called a power morcellator with the foot switch, and when this is connected, the staff will be handing this over to me, and this will make sure that I can do this part of the surgery very happily.